Okay, why don't we start? So, good morning, everyone. I'm Ed Greer, Dean of the School of Business at Virginia Commonwealth University, and I'm so pleased you could all join us this morning. This is the second edition of our business conversation, and last week we had Jeff Lacker, the former president of the Richmond Federal Reserve, to give us an outlook on the economy and certainly the impact of COVID-19. So I just want to thank our community folks out there. We have alumni on the line, we have business leaders. We just thank you so much. VCU is very proud to call Richmond our home, and we have a wonderful community that not only supports the School of Business, that supports the entire university. Well, today we have the second version of Business Conversation, and we have Garrett Westlake, who's the executive director of our Da Vinci Center. Now, you're going to learn more about the Da Vinci Center in just a couple of moments when I turn it over to Garrett. But it's a wonderful entity. It's a star of the entire university. It started off as a collaboration with the College of Engineering, the Art School, and the School of Business. Now, you say that's an unusual combination. It certainly is, but we pride ourselves at VCU on diversity, a diversity of thought, and certainly collaborations. So these students that work from these various schools and colleges come together to solve monumental problems, and we're going to talk about that just a little bit today. So I do want to give a shout out to Nancy Scott at the School of the Arts, the dean there, and certainly Barbara Boyan, who's the College for Engineering dean, and they're wonderful partners to have. Now, it hasn't stopped there. We have expanded, and Garrett will talk to you about this. We invite all at the university to participate on these Da Vinci projects. So once again, thank you all for being with us this morning. We have about 45 minutes, and many of you have already submitted questions, and we'll try to get to all of those that we can. Now, we're using Zoom, and this is our 5th week of teaching completely online. And there's a chat feature in Zoom. So if you do have questions, submit them through the chat. We'll be monitoring that throughout our 45 minutes, and we'll try to get to those questions as well. So thanks again. And so now it gives me great pleasure to turn the conversation over to a great colleague, and he's certainly a wonderful addition to VCU, and that is Garrett Westlake. So Garrett, I'll turn it over to you, and you can give little insights to Da Vinci, and then we'll start the Q&A after that. So Garrett, how are you doing this morning?
Great. I can't complain. Ed, thanks for having me. Everyone, thanks for joining us this morning. And I just want to say to everyone that's joining us live and those folks that are watching later, I hope this finds you doing well and your family's doing well. And I think everyone will end up being affected by this in some way, and it's impacting everyone and all of us differently. And just wish everyone as much health and safety and well-being as can be given these extraordinary times. But, you know, I'm thrilled to join this conversation and talk about innovation in light of COVID-19. And for those of you that aren't familiar with the Da Vinci Center for Innovation, it really is a unique model in higher education to bring these different disciplines together. Our center is fortunate to offer undergraduate certificates in product innovation, venture creation, and design thinking. And so these are opportunities for students across a variety of different majors at the university to take additional coursework and earn a certificate in one of these other fields. The center is also home to the first Masters of Product Innovation degree program in the country. And this is taking those same disciplines in a graduate level curriculum and looking at the future of product innovation, both in a corporate setting as well as in the startup sector. And then we're proud to announce, and you can see it up top there, we just had a brand new program approved in the last week. And this is something that was in the works well before COVID-19, but this is a graduate certificate in healthcare innovation. And again, this is the first of its kind in the country. And this is a unique partnership between the Da Vinci Center and the School of Nursing. And in this program, students will get an opportunity to explore healthcare leadership and some of the ins and outs of what it takes to do innovation in the healthcare setting, which obviously I think we would all agree is more needed now than ever. And so, you know, in addition to the diversity of academic backgrounds that Ed was talking about, one of the real secret sauces of Da Vinci and VCU as a whole is our commitment to inclusivity and diversity. And Da Vinci serves majority women and also students of color. And that's important because traditionally innovation and entrepreneurship have not been the most diverse fields and still aren't today, but we're really starting to see a shift, and VCU is at the forefront of leading some of those changes. So we're excited to be a part of that as well. And I'm just thrilled to be here today and talking through some of the unique opportunities and exciting developments that are happening at VCU and beyond in these challenging times. So Ed, thanks for having me.
Well, thank you, Garrett. And Garrett's a great colleague, and Garrett knows this. When he was being recruited at VCU, Barbara Bourne and I were on the search committee, and we knew right away. We couldn't tell him that. He was the obvious choice for all of us, and we made an excellent choice, and he's been everything we hoped to be and even more. So Garrett's one of those leaders you do not have to push. We many times have to try to hold him back saying, okay, Garrett, we've talked about that. You've done 15 things. Just keep it down to 10 for this week. So he's excellent. But let's talk a little bit more about how the different units work together from an interdisciplinary standpoint, Garrett. How does that help innovation take place when you have these disparate disciplines working on the projects? Many times it causes confusion early on because their points of view are different. Tell us how you use that as a real strength of DaVinci.
Yeah, I think one of the things that we've learned in working with students that I think has helped show why this cross-disciplinary education is so important is the way that our programs work is that students gain an exposure to arts, business, engineering throughout the program. And then they work on a capstone project where they work on something for an industry partner, a Capital One, a Pfizer, a CarMax, a Dominion Energy. And there have been times where we've tried to shortcut the process and experiment with adding a student from business or arts or engineering that hasn't been through the rest of the program into one of those capstone teams. And inevitably it breaks down. And when we've looked into why that is, it's because we're able to work with students so that a business student coming onto a capstone project can look at a problem from an industry partner. And instead of just seeing a business problem, they're the first one to say, you know what, I think this is actually a design problem. And that ability for a student to take on a different perspective, and they may be a trained engineer and have an incredible understanding of engineering, and their ability to look at that problem and say, you know what, first we should solve the business problem here. And they turn to their business colleague and say, why don't you take a first stab at this? And as well as the co-creation. And I think we need to look to industry as well. I look at the Apple iPod as an example and compared to the Microsoft Zune, because those two are frequently used as an example of innovation in the private sector. And by all accounts, the Microsoft Zune was a better technical product, right? From an engineering perspective on spec, it was a better product. And so the question becomes, why would a better product not dominate the market? Why is everyone not using a Zune today instead of an Apple iPod or iPhone device? And it becomes down to the importance of not just the engineering, not just the business case, and not just the design, but how well those three work together. And obviously, Apple figured out that design, as well as technical specification, as well as the business case surrounding the product, was the true secret sauce to an award-winning product. And I think we're teaching students that, and they're going into the marketplace and into our local and national companies with that skill set. And that's a unique skill for students coming out of DaVinci.
Okay. Garrett, before we go into specifics on healthcare, I just noticed in the background there, you have a couple of creative things over there. Stark Industries, I think that's kind of a Marvel, Disney type thing. Can you tell us a little bit what that relates to? I know what it is. So just for the folks that don't know you and your creative talents and how you hide things back there, just kind of give us insight to that. And then we'll go over to healthcare just right after that.
Yeah, we've got great friends. You know, many of them are, I don't know whether Tony's joining us today on the call, but we've got other great partners at DaVinci. I wish this was my private makerspace. It is not. Our DaVinci makerspace, however, is currently being used by students, actually producing some great PPE and other innovations that we'll get to help our healthcare providers. But we like to have fun. I think, you know, creativity is important at all times. And so our great creative team in the DaVinci Center got to work knowing that we were going to have this call today and wanted to dress me up a little bit. So they gave me Tony Stark's workshop and implemented or infused some VCU in there. So you'll see our unicorns, the workshop back there has a little make it real. So maybe folks will find some other Easter eggs buried in there. But, you know, creativity takes many forms. As folks in the School of Business know, I think, you know, Ed and others in the leadership at School of Business have done a great job about really bringing the importance of creativity to the forefront. You know, to truly be great at business, it can't just be all business all the time. And I think it's important to be able to have fun, to explore those creative outlets. And I think my team certainly enjoys doing that. And so you're getting to share the love a little bit this morning of that Da Vinci creative flair.
Well, thank you, Garrett. And you know, at the School of Business, we do say we're driving the future of business through power of creativity. So I have to get that in there a little bit too. So let's go to healthcare. Certainly, Da Vinci started off at business, engineering, and the arts. Now it's really gone to nursing, as you said. Let's talk about some of the things you're doing on the healthcare side of things. Now, certainly VCU is a large university and it has a wonderful healthcare system down there, but all the disciplines you can imagine are down there. Tell us about how you're working with that, how it got started, and some of the specifics on the projects that you and your students are working on.
Yeah. One of the really exciting things for me in coming to VCU was that we had a university medical center and we had the health sciences. I mean, there are very few institutions that are able to do cross-disciplinary education the way that VCU does, and even fewer that can do that with the health sciences and university medical center. And so, you know, I think it's also important to point out that healthcare is not limited to just health sciences. Engineering, design, business, supply chain, these are all critical aspects, as we're learning more today, of our healthcare environment. And so, you know, looking at what our students were working on and for partners, I thought, you know, how could we do more for our own health system, our patients, our providers? How could we improve the future of health? And thankfully, we've got amazing colleagues at VCU Health in the senior leadership, you know, Dr. Buckley and Melinda Hancock, among others, Ron Clark. These leaders at VCU Health have really been open to embracing innovation as a tool for the future. And so years ago, we launched something called the Health Innovation Consortium. And this was a group of leaders from within VCU Health, the Da Vinci Center, VCU Ventures, and other partners coming together to look at how can we look at the pain points today and future pain points in the health system and look for solutions and engage students in that process so that our students can be on the front lines of understanding what the future challenges of healthcare might be and active participants in solving them. And so that work was well underway prior to the situation we find today. And we saw some incredible outcomes from our early engagement there, everything from, you know, new techniques to improving narcotic waste management within our health system. New designs for medical devices were taking place. Our master's students in the product innovation program did a 2-week sprint this fall, engaged in developing new products to help our most fragile neonates when they are born and have to be life flighted. How can we develop new technologies that make that transition from a helicopter to their care facility in the hospital a safe and efficient process? And so, you know, the ability to use our arts and business and all of these disciplines to improve healthcare has been something that VCU is already engaged in. And so when it comes to COVID-19 and our immediate response, you know, we were asked a question by a reporter covering one of our students who is doing some phenomenal work around PPE. And the reporter said, how are your students able to do this on such short notice? How are they able to immediately jump into action and start working on these complex problems? And I was very proud to share that this is the curriculum that we built. Our curriculum is empowering students to be active problem solvers and active responders and responding quickly. It doesn't take them years to get up to speed to solve new challenges put before them. They're well practiced at being able to do this. And it sounds easy, and launching new degree programs like this with nursing sound great. But I have to tell you that it takes a significant amount of leadership and commitment from an institution to make these things happen. And you can't just say that you're going to do a partnership in healthcare. Quality and safety are obviously really important aspects of this, and the commitment of VCU Health to its patients, to its providers, and to the educational opportunities for our students has really been phenomenal. I mean, it's one of those, even if other organizations wanted to do it, I think that most of them would struggle just given the complexities involved in managing these relationships and the great leadership that we have in the academic deans that Ed already mentioned, as well as on the health side is a really valuable part of what it means to be at VCU.
Garrett, I know you're working on a lot of things on the healthcare side, and certainly the health system. You mentioned Peter Buckley, Melinda Hancock, and certainly Ron Clark. And they're just good examples of how they pivoted to and taking different roles down the healthcare system down there and done it extremely well. Can you talk about specifically what you're working on? I know some things we can't talk about, and I'll just tell you too, there's a question already saying, how can you bring things to market so quickly? There's always a safety component, certainly. There are always FDA components and the like. Can you talk about some of those things you're working on and how we can get through that? Safety is very important, not to minimize that at all. So can you do that, Gary?
Yeah. So I think, before I share some specifics, I think just to frame for folks where maybe if innovation isn't what you do all day, every day, like what we do, I think it's actually a three-step process with innovation being the middle. So creativity is often where a lot of this starts, right? Creative thinking, having new ideas, that's actually the easy part. If we put our minds to it, we can all kind of come up with new ideas and better ways of doing things. So let's use a ventilator, for example. If we took some great people and we put them in a room and we said, let's talk about how we create a new ventilator, their creative juices would flow and they'd probably come up with some good creative ideas. Innovation is the next stage of that. And innovation takes over. Innovation is the implementation of new ideas. And that's really important because implementing new ideas in healthcare, to your point, Ed, is really challenging because you have to get the testing and the safety. And that's often why people don't pursue innovation in healthcare. It takes a long time. It's very procedural. You have to really adhere to a lot of standards. And that's a turnoff for some people and maybe inhibits innovation. And the third stage is entrepreneurship. And I think entrepreneurship is typically thought up in a startup environment or purely a business sense. And what we've seen is that entrepreneurship is actually sustaining those new ideas. And so you have to have creative ideas. You have to have creative thinking to have the ideas. Innovation is the implementation. And I think we've seen examples where new ideas are implemented and something's very innovative, but it can't be sustained. And so entrepreneurship is the business sense to sustain those new ideas and make sure that they persist into the future. And we think of pivots as this sort of sexy term for startups. As an entrepreneur myself, pivots are not this sexy thing. Pivots are your, Hail Mary, trying to stay alive. Are you going to make payroll? It's your last ditch effort and you just squeak it out by the skin of your teeth. And then afterwards you're like, oh, we made a pivot. And I think that, that's an important aspect of this process is that it's a constant fight to keep new innovative ideas alive and going forward. So let's talk specifics. Let's think about ventilators. You look back in 2007, the US government actually identified, coming off of SARS and some of those other pandemics, a shortage of ventilators in the US stockpile. And they looked to the the private sector to come up with a new design for ventilators that was cheaper, able to be fast produced, and so they could grow the American stockpile of ventilators. And a startup company in California took on that challenge. 3 years after accepting this bid, they produced some prototypes that they brought forward for approval to the FDA and CDC. They were getting great feedback on those prototypes, and they were producing these at a fraction of what other existing ventilators on the market were going for. And the thought was the cheaper the ventilator could be produced, the more the US government could buy to put in their stockpile. Well, this startup was, like many startups, acquired by a larger medical device manufacturer who immediately took some of the key members off that team, put them on other projects. Innovation slowed. They stopped producing as many updates to the prototype. And before you know it, they canceled the contract with the government and said, you know what, we can't actually produce it at the price point you said and to your specifications. So the deal went dead in 2014. And now we find ourselves with a significant shortage of ventilators. Well, the actual process of producing these new ideas, to put it in context, when this started, we had a team of VCU faculty supported by some students that immediately got to work on how could we produce new ventilators. And some incredible faculty members from the College of Engineering, from physical therapy, from health sciences, all came together and said, let's build a new ventilator in case we need something. 3 to 4 weeks later, we have a VCU device, many of you may have seen this in the news, a VCU homegrown ventilator with the FDA awaiting fast track approval for medical use that can actually be 3D printed and built with some local parts right here in-house at VCU. VCU could build tens of ventilators a day in-house in case we needed them under these new designs and to these specifications. Our partners at VCU Health are running simulations on this new device in the simulation lab that's testing the safety of this device. And I just think that you look at the previous timeline, we're talking about 2007, and a company took years to come up with a new prototype, and still we didn't have any in the stockpile. And then you bring some smart people together under the constraints of a current pandemic, and in a couple weeks, they were able to develop a new device that might go on to save countless lives. Now, this device, don't get me wrong, is not commercial grade. It's not something that we would then go on to produce and put regular day-to-day patients on. But in case of an emergency, this could truly save lives. And I think it just shows that innovative spirit, but it involves that key piece in the middle, which is the implementation. These individuals could have come up with the idea for a ventilator before now, but the pandemic gives us a unique opportunity to expedite the implementation of some of these innovations and these creative ideas. And so the ventilator, the VCU ventilator is one. And then a second example that I really think shows how we approach problems is critical, and that's personal protective equipment, PPE. We've heard a lot about a shortage of PPE for our healthcare providers. And when you look at this, one way to look at it is we don't have enough PPE. And an old economy model approach would say, well, we don't have enough PPE, so how do we produce more, right? How do we build more, masks and face shields? But the new design thinking based approach to say is, what is the problem? The problem is we don't have enough, and there might be multiple solutions to that problem, of which making more is just one. And so VCU is running a healthcare sprint with our students. We have 38 students from multiple majors participating in this sprint format, and PPE was one of the things they're working on. One student team decided to work on actually producing PPE. Another team is looking at sanitizing and reusing existing PPE. And so they're both solving the problem. So how could we sterilize PPE at the end of a shift and reuse it and get more life out of our existing equipment? And another team is looking at how can we manufacture additional PPE. And that's really exciting to me to see our student teams using what they've learned in classes around not just looking at one problem and saying the solution has to be make more. They can take a step back and say, how can we approach this problem from multiple perspectives given our backgrounds? And I think I'm seeing that every day with all the varying projects that we have 8 of those right now in the healthcare sprint that our students are wrapping up. It's been so exciting to see what they've been coming up with.
Okay, that's wonderful, and it's very impressive. And certainly when my opening remarks, I talked about the community. We're proud to call Richmond our home. Can you speak about how the business leaders or community leaders, political leaders, whoever, can reach out to you when they have a issue or a problem that possibly you and the Da Vinci students can help solve? Can you speak to that just a bit?
Yeah. So, I think one of the pieces that I think is part of the ethos of VCU is very much being an urban research university means that we work hand in hand with our community partners. And Da Vinci is no exception. I think, we've been able to work with Code RVA and a number of nonprofits in our community. We hosted a nonprofit accelerator this past fall. It was a great opportunity to work with the Hull Foundation and their nonprofit accelerator. We brought 3 nonprofits from the community to campus. And one of our phenomenal graduate students in the master's program, Rafa, was actually the lead facilitator for a number of those sessions and helping our local nonprofit partners advance their mission in our community by using the business and engineering and design tools that our students were learning as part of their education. And so we are always open to individuals, no matter whether they're an individual or a small organization or even our large partners, reaching out to us and asking what we might do together. A great example of how this happened recently is we had the opportunity to work really closely with Hurricane Construction. And Mark Hurricane has been a great community partner to Richmond, as well as to VCU and the Da Vinci Center. And through our collaboration and partnership, emerged this idea for the first of its kind student storefront. And this fall, we're gonna open something that's never been done nationally, which is a brick and mortar storefront where VCU students are gonna have the ability to sell their products directly to the public. The community is gonna be able to see firsthand the incredible things that our students are coming up with. And we're able to open a facility like this on Broad Street thanks to the partnership of Mark Hurricane and Hurricane Construction. And we're also exploring new construction technologies at the same time. We'll see whether it comes to fruition. One of our students in Da Vinci is working on a new product that's actually a paver, like you might put in your garden or build a retaining wall with, that's grown from mushrooms. So these are actually mushrooms that he can grow into shapes that have all sorts of great properties for construction, that's entirely organic, that's permeable, that's green technology. And so being able to work hand in hand with our community partners in construction means that they're able to tap into the innovative minds of our students when they're developing these early stage ideas around using mushrooms to grow pavers. Our students have access to construction leaders to bounce their ideas off and help guide them in where they might take those innovations. And so we see things like the storefront being an opportunity for more community members to come to campus, to engage with students, to share what they're working on and see what synergies exist. And so, happy to take phone calls and emails and outreach from partners about things that they're working on in our community or nationally. That's really what makes the work that we do in Da Vinci so current and so impactful, is the input that we get from our community partners.
Well, that's also impressive, Garrett. I think you mentioned about the storefront on VCU's campus. If you go a little bit further east, certainly on the healthcare campus, it's a lot of construction going up down there because it's needed from the community standpoint. And one of the things, as we were talking about healthcare, you talked about ventilators, you talked about PPEs, but the other thing that's in the news all the time is the need for testing. Who has antibodies that survived the COVID virus already? Can you talk about what your students are doing on the testing side of things, how you're trying to help VCU Health? Certainly they've done some great work already down there that relates to testing. Can you just expand upon that just a bit?
Yeah. So I think this is another example of how I wish there were more opportunities for us to share the incredible work that our faculty and students are doing at VCU on a regular basis. Already in the fall semester, we were approached through the Health Innovation Consortium with an incredible faculty member and clinician looking at how we might improve testing for pediatric patients using technology that had never been used before. So how can you use the mucus in your nose at home to do rapid testing? And this was something that was already under development at VCU prior to COVID-19. And we had a team of students working on this. They came up with the project name was Nose Knows. And they've been working on this from a cross-disciplinary undergraduate student perspective for months. And so when the COVID-19 started to really come on the scene, these students immediately reached out to us and said, we want to be part of the solution. Can we make a pivot in our capstone project to focus on the technologies and the approach that we were already doing around using this testing, where maybe one day you're able just to use a smart Kleenex, as it were, and blow your nose at home and get some real-time results around whether this is allergies or what may be going on. And so these students stepped up to the plate and said, hey, we know we're working on this other important item for VCU. Can we make a pivot and start to really hone in on COVID-19? Now, is this team of undergraduates going to, give us the silver bullet that does home testing in the next 60 days? Probably not, right? But how impressive that this work was already going on, already underway from undergraduate students, that they step up and say, we want to be a part of the solution, and they can continue to make great progress, right? Like the work they're doing is helping to inform the future of testing, and we might see some aspects of their research and their product implementation here in the near future. And so, this idea that we're doing some of this innovation only now in response to COVID-19 is a little bit of a misnomer. A lot of the exciting things that you're seeing in the news coming out related to VCU and COVID-19 are the result of countless hours and effort that's been put in for years and years and years across the institution. And this gives us a little bit of an opportunity to share some of that in a little bit more public way with the community.
Okay, we've been talking about certainly COVID-19 and an impact on obviously our health, the economy, et cetera. Let's kind of go back a bit. One of the things that you did so well in Da Vinci, you reached out even from an international standpoint. You were taking your students to Italy. Now, obviously can't go there now. Can you talk about that? Maybe how your work can just leave VCU and impact the global stage with the work that you started. And we can't do that right away, but I'm looking forward for the day we can start traveling again. Can you speak about that process a little bit and the other universities you were working with around the globe to make that happen with your students?
Yeah, no, I think one of the important pieces of innovation is always trying to look to the future. And so when we look to the future, we know that we operate in a global world today. I mean, I think, again, COVID-19 has taught us just how global we are and how much travel existed. But for our students, they're graduating from a program in Richmond, Virginia, but the work that they do is going to be on a global level. And so we were looking for strategic partners that also saw that the future was going to be more global than it ever we could have imagined years ago. And so we partnered with an organization called the European Innovation Academy that worked with select schools from all over the world to bring students together to go through a technology boot camp to launch new tech companies. And VCU is proud to be among 3 university partners in the United States. Stanford, UC Berkeley, and VCU and the Da Vinci Center were sort of the inaugural US partners to go abroad to Italy, also to Portugal, and bring students together. And what I loved about it was that EIA shared our commitment to cross-disciplinary education. So students are coming from these different academic disciplines, but also from different cultural backgrounds. And to see the impact that different cultures have on product innovation has been really valuable, because what may work for China is not the same as the UK or Canada or the United States. And so our students understanding how their product development might work in one location versus another gives them those additional lenses and perspectives that they can try on when they're doing product development and product innovation that we believe is critical for producing the leaders of tomorrow. And so we hope that our colleagues at EIA, which are taking a hiatus right now given the global environment, we hope that they're quickly able to get back to it in the years ahead, because the friendships, the networks, and the perspectives that our students have gained through that global experience have been invaluable. And I think a testament to that was that one of our current graduate students who had the opportunity to go to Italy last summer and participate in this program, when we were doing our healthcare sprint, one of his first responses to the healthcare sprint was to have a sidebar with me and our other faculty members and say, this is fantastic and what we're doing at VCU is great, but what about the rest of the world? What about communities that don't have the same infrastructure that we do? How can what we do help them? How can we help, should we be sending 3D printers and these design files to some locations that don't have the access that we do? How are we thinking about other communities beyond Richmond, beyond the United States? And I really think that, that speaks a lot about him as a person, but it also speaks a lot about his perspective that the problems we're facing are not just local, not just regional, but are global, and he wants to be a global problem solver. And I think that cross-cultural, international aspect of education is a part of what's giving him that perspective.
Well, good. I'm just looking at your background again, and it reminds me that so much of your work is collaborative, so much of your work is hands-on, and the students are getting together and working closely together. And obviously with social distancing and things like, we just can't do it. So how have you made that pivot from having those students working so closely together, now doing it remotely through Zoom and other methods? How's that working for you? And what about the future of that also?
So we've got some unreleased virtual reality technology that nobody else has that allows us to do it in I wish that was the case. Our students have been really creative. We already had a number of students that worked full-time while they were going through our programs, that needed to be in different places, that were traveling to conferences, that were speaking nationally, that were pursuing the startup that they did with their international colleagues. And so, it's not the same as not being allowed to be in the same place, but our students already had some great experience with using new tools, a lot of online project management. If you look at a number of our companies today, I had the opportunity to join one of our great sponsors, Capital One, and their product teams out in Virginia the other day. And they were, plugged into a national webinar of all of their teams across Capital One, and people were on a mass video call and chatting with each other and sharing insights. And so, our partners and organizations have been using some of this technology, and our students have been exposed to it and have been practicing with using, product management tools that everyone can stay involved and track the progress of projects across platforms. And so some of that work continues today, and we're having to find new ways to share with each other. We've been using just amongst the Da Vinci Center team, some daily stand-ups to bring us all together to replace those hallway conversations. A lot of our innovation happened in the time we spent together as a team, being creative, being silly, spending time with each other as colleagues and as people. That's where some of our best ideas came from. And so we're trying to find ways to recreate those. We do a Friday afternoon front porch meeting where everyone on the team sits on their back porch or their front porch in a more relaxed setting, and when we just recap the week for each other. And that's where some of our brainstorming takes place. And our students are seeing that as we model that for them. And we're using some technologies that do quick video chats where maybe you'd pop into someone's office and say, hey, I just had this great idea. Maybe we could work together on this. And we're using some video drops to do that, where you can leave a video message for someone and say, hey, I was thinking about you today and had this cool idea that we might partner. And, it's not the same as dropping in someone's office, but it certainly keeps us connected. And when we look to the future of the work that we'll do, a student asked me last night, I taught in our NO 200 class for a lot of our first year students in Da Vinci. And, she asked me, she said, what's the future of fall semester going to look like? And I said, I don't know. But what I do know is we're going to do what we do in Da Vinci, which is we're going to experiment, right? We're going to have an assumption. We're going to test that assumption, and we're going to iterate upon it. And we're going to keep working to get it right. And we're never going to stop trying to improve it. So maybe today we're using one technology. Tomorrow we're using a different one. We're scrapping it. We're going back to the first one. We're leaping ahead 2 steps to a new thing that's never been tried before. It's a never-ending cycle of iteration and improvement. And I think that that's what's going to get us through this, is not looking for that, this is the solution. We've got it. Game over. We can go back to how we were doing things, but a constant growth mindset of looking for new tools, new inspiration, and trying things. And I think that that's what we teach our students, and that's what we've got to model it as faculty and leadership.
Garrett, one of the questions came in. It's really a comment. You mentioned virtual reality or holographic images. I know you were just kidding a little bit, but there is a real use for virtual reality now. And I know you're I shouldn't be giving this away, but your family members are big Star Wars fan, and you talked about this virtual reality. They were fighting Darth Vader, but from a business standpoint or new idea, prototype, and interventions, can you talk about virtual reality a little bit and how that works for you and your students?
Yeah. So I think, one of the interesting things about virtual reality or augmented reality is, the user experience. And I think this is a real shout out to our colleagues in arts and design, that the user experience of this technology becomes very important. The technology's there, right? Our engineering colleagues have done a phenomenal job of producing something great tech where you can take your phone and you can hold it up or you can wear a headset. But it's really the design of that user experience that makes you not get nauseous, right? How can you wear this for a long period of time? How do you mitigate a lot of the environmental controls? So that the really great VR systems are using things like temperature control and humidity to really create immersive environments. And so I think that user experience from design is important. And then the Star Wars, I saw at an innovation conference a great use of Jedi training in a virtual reality environment that my children certainly enjoy. And those offer us an opportunity to try, and that's the business side, right? That's the marketplace allowing us the opportunity to advance new technologies because we're more forgiving or willing to try things out in a virtual reality game, in a Star Wars game, than maybe we are in how we move our classroom instruction to a virtual reality environment. And so drawing inspiration from this virtual reality game where we're learning, my children are becoming Jedi Masters, maybe as we speak, although it doesn't sound like it, it's been relatively quiet. if we're using these technologies to teach people to become Jedi Masters, why not teach them physics? You know, how big a leap is that actually to do some teaching in that modality? But I think we have to be mindful of access, and that, you know, as we advance innovations, we have to make sure that we're being inclusive and that we're not leaving people behind, particularly individuals and groups of individuals that have been previously marginalized and that our systems have excluded from opportunity in the past. And I think the ethics of responsible innovation is something that we have to be particularly attuned to. And so, as excited as I get about virtual reality, I want to be mindful that we're not putting undue burden on communities that have not always had access. And that as we move forward, that we're doing so together, and that we're not doing so at the expense of those that don't have the same privilege that others do. So I do think there's great promise in some of those new technologies, but inclusivity and the ethics of how we roll some of those things out is going to be really important.
Thanks, Garrett. We have about 1 minute to go. So you've been great as always. I'm still missing the time that we can all get back together. You mentioned the fall, what will happen in the fall. We just don't know. We're hopeful that we can get together soon again, but we'll see what happens in that. I just want to give you 1 minute or two. Well, let's give you a minute, Garrett, if you can just conclude. And I love your thoughts on how we're so inclusive at VCU. We're a very diverse campus. We're very proud of that. And that's really our strength. So I'll give you a 30-second close, and I'll just close this up and just thank everyone again for joining us.
Well, again, you know, Ed, thank you for having me. Thanks to the School of Business for putting these on and finding ways to bring people together. Thank you, everyone, for joining us today. You know, I think I just really want to talk in the last little bit about community. One of the things that drew me to Richmond and to VCU was a real sense of community and people coming together, and not just in the hard times, but even when things were going well, we found a way to support one another and help each other. And I think what I found when coming to VCU was a leadership team and the deans that work and support the Da Vinci Center every day, a real sense of collegiality and community. And that trickles down to their respective organizations and with our community partners as well. A lot of the work that we're able to do is because of an incredible sense of community. And I think that it's really important that while we are socially distanced right now and we can't come together in person as community, that events like this that still bring us together, that allow us to reflect on the ways that we do work together and still can work together are really important, because I would hate for us to lose a lot of what makes VCU, Richmond, and this community special is the togetherness and the working together and the collegiality and the helpfulness. And so hopefully events like this are scratching that itch a little bit, but I really look forward to the future when our communities can come back together in person and support one another. And so, you know, I hope everyone stays safe. I hope everyone stays healthy, and that their respective communities, whether it's their immediate family or their extended community, stay safe and stay healthy as well.
Okay. Thank you, Garrett. We are out of time. I do want to thank everyone for joining us via Zoom. It's not like being there, but it's close. We're getting used to it. So stay healthy, everyone. Stay safe, and we'll follow up with another business conversation in a couple of weeks. So thanks again.
Great. Thank you, everyone.